One of the key aspects of a great medical school, a great medical center, is that everybody benefits from the people who are around them. Clinicians benefit from being with other great clinicians, researchers with other great researchers, educators with other great educators, but also the combination of clinicians with educators, educators and clinicians with researchers.
One of the very unusual, almost unique aspects of the Diabetes Center is that this relationship between the clinical and research activities is so carefully integrated.
Several large collaborative efforts working to make discoveries at the bench that can be translated as rapidly as possible to patients who are seen right there at the Berry Center, because the scientists and the clinicians are working together in the same facility.
There's a culture of learning and research and dedication to research. And it's that has, I have just not found it anywhere else.
I think collaboration in modern medicine has become so much more important than it was 20, 30 years ago, because medicine, biologic sciences, research has become so much more complicated.
We're studying bladder cancer, a very important disease, kills a lot of people and is a very debilitating disease. Jim outlines the medical problem. We think about ways to address that medical problem in the laboratory, and then we learn something, and then Jim has brought that back to the clinic in terms of clinical trials that are working, that are helping people.
Our collaborative efforts are extremely important, not just looking at the most current therapies, but also thinking about what's going to be coming in the future.
One of the things at Columbia that we're not lacking is for talent. Sometimes the collaborations are not, between a cardiac surgeon and a cardiologist, it's between us and pulmonary, or us and gastroenterology. We can't operate in our own one narrow space of just the cardiac disease. You need to have talented individuals throughout, and not only from the physician side, but from nursing, from physical therapy, social work, and everyone really needs to move the care of medicine forward to best help the patient.
Tomorrow's doctors need to be educated on collaborative science, on how to work with one another, how to engage with researchers, how to work at the bedside, how to work alongside practitioners from other disciplines.
When I'm in the ultrasound room and I diagnose a family or a fetus that has a birth defect or congenital heart disease, we very quickly get them in to see our colleagues in neonatology and pediatric cardiology. And by working with Ganga and with pediatric cardiology and pediatric cardiac surgery, we can provide them with a very realistic chances for what their child will be like, not just in immediate neonatal life, but as a teenager, and what their adult life is going to be. And the prognosis for our children with congenital heart disease that we diagnose now is amazing. We've seen such advances here at Columbia because of our multidisciplinary collaboration.
I really can't think of any other two disciplines of medicine that really have come together the last 15, 20 years and will continue to grow together. The spine is a combination of both the bony architecture, which has traditionally been an orthopedic surgery component, and the neurologic system, which has traditionally been obviously part of the neurosurgery, and together they really coexist. It really is, I think, a melding of two different disciplines.
We have collaborated on a number of different levels, both patients, educational research data sets that we're collecting. This is the future of what we do. This is, I think, going to improve the education of our residents and fellows. It's going to increase our ability to advance the practice and science of medical care, and most importantly, I think it will increase the quality of the care that we deliver to our patients.
The Board of Advisors are there to advise the dean and the faculty on all matters that happen at a medical school and a medical center. We found that we didn't have enough time to really dig into some of the areas, and the idea was floated and everybody accepted that we should have councils. We selected people who both had the interest and were able to bring people together and do some organizing. And we did that very effectively in selecting people who wanted to know about diabetes, wanted to know about hypertension, cardiovascular disease, cancer, right down the line till the latest hot thing, precision medicine.
They have three roles, really, but dominantly to collaborate with our department to achieve our dreams. So their roles involve First, feedback, what are we doing well and what can we improve on? Secondly, to use their influence to share the news about our department with their friends and other colleagues and to increase awareness. And thirdly, to help us with philanthropy so that we can create programs, we can retain and recruit the best faculty to provide better health care.
I've attended a couple of the council events and met some very fascinating, knowledgeable, and very successful philanthropists that are helping us and guiding us at Columbia.
Having people on the council that are engineers, that are lawyers, that are businessmen, who see things from a very different angle. And that can be from how you organize your clinic, to how you have patients come into the hospital, to how you do a procedure.
This is a group that feels passionately about the medical school, about CUMC, and about our mission, and has been extraordinarily helpful to me personally. These individuals have helped us raise the profiles of those programs, have provided enormous support, both financially and spiritually, if you will, for our faculty, and really understand what it takes to make a great medical school.